healthcare promotion related to the Aboriginal and Torres Strait Islander people in a remote community. Group presentation for 401-206, the Aboriginal and Torres Strait Islander unit. Glubna Liaquat, Raham, Grace, Benny Teta, and this group acknowledges the presence of the Aboriginal and Torres Strait Islander people among us. Therefore, this presentation contains some pictures that may not be pleasant for your viewing. Thank you.
The context covered in this video will highlight the impact of Aboriginal and Torres Strait Islander culture on their health, the major healthcare issue among the Aboriginal and Torres Strait Islander community in remote areas, followed by healthcare need of the day. In the end, some recommendations are being made for the culturally competent safe nursing practice in the Aboriginal and Torres Strait Islander community.
According to the Australian Geographic magazine, the Australian Aboriginal and the Torres Strait Islander people are the oldest living civilization on Earth, and together they are the most significant part of the Australian Aboriginal community. They have their own distinctive culture to follow and languages to speak. Australia itself is made up of 512 language groups, and each group gets differentiated by the language they speak. For example, the Aboriginal community in the southeast of Australia speak Inuan or Nuan, while people in the southwest speak Imangu or Ying.
Culture has a significant value in the Aboriginal community. Culture gives them a sense of identity, belonging, self-worth, and provides them the social support they need. Indigenous culture has an invaluable impact on Aboriginal people health. The Indigenous concept of health is not just the physical well-being of an individual, but it also focuses on holistic care and encompasses a spiritual, social, mental, and cultural aspect of life for the whole community. When the harmony between these interrelations get disturbed, the Indigenous people experience ill health.
The land has a significant value in the Aboriginal culture. Connection with the land is very important for the well-being of the Indigenous people. According to them, the land was created by the journey of their ancestors during the dream time. Therefore, their spirituality, identity, and health is directly linked to the land. They feel more happy, healthy, complete, and contented when they are in their country. And country means only the area where they grow up or where they belong to, not all states of Australia. For instance, Gadigal is the land for those who are born in Sydney or brought up in Sydney. They are also known as the Eora Nation. In short, their connection with the land is deep and strong, and their physical and mental well-being is closely associated. Staying together as one big family is the integral part of an Aboriginal culture. Data collected in 2012 to 2013 showed that 23% of Aboriginal and Torres Strait Islander people were living in overcrowded households compared to 5% of non-Aboriginal community in Australia, as we can see in this table. A very recent statistics has also shown that more than half of Indigenous Australians in remote areas are living in overcrowded households as compared to 17% in major cities, without considering the risks associated with overcrowding such as domestic violence, suicide, poor mental health, and high risk of transferring contagious diseases. In 2014 to 2015, about 20% Aboriginal and Torres Strait Islander people were hospitalized with the diseases associated with poor environmental conditions, and overcrowding was one of them. Culture also influenced the Aboriginal and Torres Strait Islander people decision about their health, the use of their health services, their acceptance of specific treatment, and their role in the prevention of disease. Health disparity between the indigenous and non-indigenous community is large and persistent. This big gap is putting more and more Aboriginal people at risk of suffering chronic diseases like cardiovascular disease, kidney disease, and diabetes. Highest mortality rate and lowest life expectancy are one of the consequences of this health disparity prevailing in the Aboriginal community, as shown in the graph. 2016 census report organized by the State Bureau of Australian Statistics reveal persistent health disparity is making an Aboriginal male more susceptible to die 10 years earlier than non-Aboriginal male, as shown in this table. The condition is even more worse in remote areas with 10.5 to 12.5 less years of life and highest morbidity rate, which is making the Aboriginal people 6 times more susceptible to have type 2 diabetes than non-Aboriginal people, and the chances for having cardiovascular disease are even more higher, almost 10 times higher. In 2008, federal government had took an initiative trying to close this health disparity gap with the help of Aboriginal community. A slow but continuous progress has been pronounced in recent years. Diabetes mellitus is the second biggest cause of mortality among the Aboriginal and Torres Strait Islander people. Diabetes is an elevated level of glucose in the blood or body inability to produce or use insulin effectively. Aboriginal and Torres Strait Islander people experience a disproportionately high level of diabetes. They are 3 times more likely to have diabetes than non-indigenous people. And Aboriginal and Torres Strait Islander children are 8 times more likely to develop type 2 diabetes in their lifespan. Numbers are multiplying in remote areas. Rate of mortality due to diabetes in remote and very remote areas are 2 and 4 times higher compared to major urban cities, as shown in the graph. Hospitalization rate because of diabetes is 2 and 3 times higher in remote and very remote areas compared to urban areas. There has been no decrease in death rates from diabetes for Indigenous Australians over the last 17 years. Other than government unjust and substantial policies in the past few decades like protection, assimilation, and segregation, the social determinants of health such as environment, nutrition, education, unemployment, and housing have significantly contributed in poor Aboriginal health outcome. The greater burden of the disease in remote areas can be largely attributed to physical inactivity. Low level of physical activity or no activity at all is a risk factor for a range of health conditions, and diabetes is also one of them. Statistics show an 18-year-old obese Aboriginal and Torres Strait Islander person is 5 times more likely to have diabetes as compared to other Aboriginal people in the community. In remote areas, just over half of the Aboriginal and Torres Strait Islander adults do more than the recommended 30 minutes of physical exercise, and 1 in 5 don't do any activity at all. Physical activities are highly recommended in remote areas as means of preventing diabetes, such as walking and doing bits of exercise. Diabetes rate in remote areas is alarmingly high. It can also be associated with the consumption of poor nutritional food. Recent study has shown people in remote areas are often limited in their food choices because they either have no access to fresh food or they have to travel far to get it. According to Census Report 2016, almost 10% people living in remote areas of Western Australia has no access to fresh fruit and vegetables, and about 15% of people have to travel to 100 kilometers to get fresh fruits and vegetables. 15% of indigenous people lack fruits in their daily food intake, and 6% lack vegetables, and 3% do not eat both fruits and vegetables. Aboriginal and Torres Strait Islander nutritional status is also influenced by their social, economical, and geographical factors. Inadequate consumption of healthy foods such as fruits and vegetables increases the risk of developing diabetes. Cheap and easy access to fresh food in remote areas is highly recommended to combat this disease. Lack of education is also a contributing factor in the burden of disease among the Aboriginal Australians. 60% of Aboriginal children are behind in education than non-Aboriginal children, and only 10% Aboriginal children complete their Year 12 education in a country where the literacy rate for non-Indigenous children is 99%. And in remote areas of Northern Territories, only 36% have access to library and only 4% go to school. Illiteracy is making the Aboriginal people more and more susceptible to suffer from chronic diseases such as diabetes. For instance, an illiterate person does not know the value of physical activities and the importance of nutritional diet, and it is very hard for him to make healthy food choices. While an educated person with diabetes knows how to check blood sugar, choose best healthy food choices, and maintain weight, as well as he keeps an eye on his cholesterol and sugar level. Through Closing the Gap scheme, government is trying to ensure that all Indigenous children under the age of 5 in remote areas have access to early childhood education within 5 years. The gap for Indigenous students in reading, writing, and numeracy should be halved in few decades, if not eliminated completely. Sufficient education opportunities in remote areas will contribute to better health outcome and less burden on Aboriginal people and on Australia as well.
Income and employment is considered one of the significant social determinants of health in the Aboriginal community in remote areas. The employment data collected from the Australian Census report highlighted that Indigenous people are having low rate of income and very high rate of unemployment compared to the non-Indigenous people. As a result, they are facing chronic illnesses and experiencing poor health because they cannot afford healthy food or access to health services, which leads to the increased cases of diabetes and other chronic illnesses. Improvement is needed in remote areas to improve the income and employment among the Aboriginal community.
Numerous studies have shown that Aboriginal people are reluctant to use healthcare services that could be associated with their past frightening experiences in healthcare facilities, like the abduction of their children and exposure of stereotyping. To provide a culturally safe nursing care in the Aboriginal community, a nurse needs to be very well aware of the patient's cultural background, so a person can be treated accordingly with respect and dignity. A nurse should also have a person-centered and holistic approach attitude towards Aboriginal patients, with a good understanding of cultural safety. A nurse can provide culturally competent, safe care to the Aboriginal community by having a culturally appropriate body and verbal language, and by showing respect to their culture, as well as having non-judgmental and non-stereotype attitude towards them. The use of effective and non-offensive language is also essential for effective communication and for good rapport. To build a good rapport with the Aboriginal patient, a nurse should go extra mile by listening to them more attentively, by showing them that Aboriginal health matters, making them feel safe, invaluable, and realizing them that they are the vital part of Australian community. This requires a range of culturally appropriate prevention and management programs, along with culturally competent safe nursing practice. The Aboriginal culture is unique, distinctive and rich, and it has a deep impact on the Aboriginal people health and well-being. Deep and clear understanding of this culture is needed to provide the best care to the Aboriginal people in the healthcare setting. A mandatory question should always be asked upon admission so the care can be provided accordingly with respect and dignity. As a nurses, we should always be demonstrating a good listening skill, so we should listen them more attentively and give them the time they need to think and speak. We should always let them to make their own health decisions, as they are the boss of their own health. We should always be asking for permission before starting any surgical procedure or explaining them what's going to happen. We should help them with the paperwork if they are unable to read and write, as studies have shown that many elderly Aboriginal people cannot read or write. Closing the gap is a good initiative with new inventive programs to help the Aboriginal people in healthcare facilities. We should try extra hard to build their trust by asking open-ended questions, by showing positive attitude, and by having an effective relationship with them.